Hey guys, what's up? What's up? Mr. John here with you again on the Nclex-Rn review. So today we'll be talking on care of special population. So you'll be doubting like, which area of the Nclex is this? Yes, this is another special area of the Nclex where most nurses do not practice before going in for the Nclex. Just a briefing for you guys. The US is a multicultural country with people from various backgrounds, various part of the world, from the ancestry level, people from Asia, Africa, Central, Southern America. And so you are coming to work in a multicultural environment. So the NCLEX wants you to understand this population in order to be able to provide possible best care. So we are talking here about prisoners, refugees, people with disabilities, people of Native Americans, people with the African history, African Americans, Asians, Americans, Hispanic, Latinos. So this area, you might have come across some questions in the NCLEX and they have some specific questions. So get your pen and paper and let's practice some questions in this area. Let's go. Number one. So it says, the nurse caring for a refugee considers which, which health care needs a priority for this client. Yes. A says, access to housing. B, access to clean water. C, access to transportation. D, access to mental health care services. Which is the right answer? D, access to mental health services. You might be trying to apply some physical, the uh, Maslow hierarchy of nursing here. No, it doesn't work here. Let me explain you why. Uh, People, refugees, they suffer a lot of mental health care services because these people, they go through torturous environments, they go through a lot torture events, they go through a lot in their life, and they tend to have a lot of psychological issues. They need mental health care. So this area is particularly important. They also suffer, second on the list will be poor nutrition, sleep deprivation, violence, physical and emotional trauma. These are the conditions that refugees do suffer. Refugees come from countries of war-torn areas or natural disasters, and they live here in the US. So the NCLEX wants you to know uh, particular areas of concern. So before we move to the next question, I will want to give a briefing on what we need to know about this uh, people of special population area here before we move forward. We also have homeless people. We have, like I said before, immigrants, right? Prisoners, people who have language barriers, like we have Hispanics and Latinos, they speak mostly Spanish. We have Native Americans, and in the Native Americans, they have high rate of disease conditions like um, infant mortality. They have sudden infant death. We're going to see sudden infant death when we'll be looking at care of the newborn. So these are the two peculiar conditions with Native Americans. Hispanic and Latinos, they have issues of language barriers, and they are very much concerned with their diet. You will see questions in this area. We have the African Americans, they have high rate of disease conditions like obesity, diabetes mellitus, hypertension, cancer, heart diseases, and asthma. Please take note of this disease I've just mentioned. And the highest cause of death to people of African American descent, we have heart diseases, cancer, and stroke. Nclex is very peculiar to this area. We have Asian Americans. You might have seen some question talking about Vietnamese and so on, Southern Asians, Southern Indians. So they have disease conditions like tuberculosis and hepatitis. They have high rates of this disease condition. We have native Hawaiian. They also have sudden infant death and hepatitis B. You might have come across some questions of this nature. A particular population that the English wants you to know why you work here in the US is people of LGBTQ. Okay, we talk of lesbian, gay, transgenders, and we have bisexual people, and we have queer or questioning individuals. I don't even know what that is, please. So what is so peculiar about these people? When they come to your facility, you have to make sure that you ask them what they want you to address them. The he or she, this is where the he or she issue comes in. Okay, they might not want you to address them by their first name, which is common with any other person here in the US. And you communicate with them using open-ended questions, okay? So you want them to give the opportunity to speak and to tell you what to address. Then don't use close-ended question. They will look like being judgmental. You want them to answer the yes and no. Also, in this group of transgender person or the LGBTQ people, they are prone to STDs, HIV/AIDS, HPV, especially among the transgender person of those men who have sex with men. You might see some question like that. They have high risks of HIV/AIDS. Okay. They, because of their status and the way they are, they face rejection in the society. So they have a lot of depression, suicide thoughts, drug abuse, and they also take hormonal therapy. They also take hormones. So hormonal therapy is common with this group of people. In case wants you to know this, so you know how I have had the opportunity to take care of some of them. They are very nice people. Please, this is America. You have to do what you have to do and stay professional, okay? Let's move to the next question. Question number 2 says, the nurse working in a correctional facility is caring for a new prisoner. The client asks about her risks associated with living in a prison. How should a nurse respond? A, healthcare is very limited in the prison setting. B, living in a prison isn't different than living at home. C, living in a prison can predispose a person to different health conditions. D, living in prison is similar to living in condominium complex or dormitory. Which is the right answer? C is the right answer. Living in a prison can predispose a person to different health conditions. Now, I want you to know, what are these different health conditions? Not necessarily knowing that, because in some questions, they might list living in prison predisposes to this, and then other option, they have other disease condition, and you'll be confused that Mr. John just said health condition. He did not mention those disease conditions that those who live in prison are predisposed. So they are predisposed to tuberculosis, HIV, STDs, and so many infectious diseases. Okay, many infectious diseases. So you have to know. Other options here, they are okay, but they are not peculiar to persons living in a prison. You get that? That's the difference in that question. Next question. Question number 3. The nurse is planning care for a client of native Hawaiian descent who recently had a baby. The nurse develops a teaching plan and includes information about which measure that is related to a newborn complication within this ethnic group. Did you take note when I made an explanation just a few minutes ago about different population and their high risks? Can you remember? Okay, A says safe sleeping. B, car seat safety. C, breastfeeding. D, baby proofing. Which is the right answer? A, safe sleeping. I made mention that people of native Hawaiian have high risks of infant mortality and what we call sudden infant death syndrome. Okay, go and read about that. I don't want to talk about it. We will see it when we're doing care of newborn. That is the right option. So this is a major concern to people of this population, and Nclex wants you to know. Number 4, which teaching method is most effective when providing instruction to members of special populations? A, teach back. B, video instruction. C, written materials. D, verbal explanation. Which is the right option? A, teach back. So what is common with people of the special populations? They might have language barrier, mental issues, right? Poor nutrition, poor living conditions. So what happens? When you teach somebody and you want to know if the person understands what you just said, you want the person to do a teach back, what we call a teach back, either by demonstration, right? Either by demonstration. You want to be sure that communication has gone through. Okay? Teach back method is applied in many areas of nursing, in many areas of communication. It's very, very important. So you want the person to return. If the person is able to speak in the same language, you want the person to do return explanation. Or if the person is able to demonstrate, you want the person to demonstrate. To do what? To be sure that communication has passed through. The person understands what you just said. This is very, very important. Okay. Next question. Which health concerns should the nurse be aware of as risk factors when caring for clients of African American descent? Which health concerns should the nurse be aware of as risk factors when caring for clients of African American descent? Select all that apply. Can you recall my first explanation where I said, okay, A, cancer, B, obesity, C, hypertension, D, heart disease, E, hypothyroidism, F, diabetes mellitus. Select all that apply. Which is the right answer? The right answer is A, B, C, D, and F. They don't have high risks of hypothyroidism. They have high risks of the others. Let me give you a tip here. Go check my video on how to answer SETA question. In SETA, like here, we have 6 options. If you choose 4 correct, you have partial points, 4 on 6, which is perfect. If you choose 3 correct, you have 3 on 6, which is good. Now, if you choose 3 correct and your 3 included the wrong one, it's a -1, so you have 2 on 6. So I made a video with technique on how to answer SETA question. Go check that video and watch. If I'm you, I will go to the ones that I'm 100% sure that are correct. Pick 4 or 3 and move and pass all the 3 and you are fine, rather than to include a wrong option that will minus your 1 point. Did you hear that? That's very important. So if I was doubting between hypothyroidism and diabetes mellitus, I will say cancer, obesity, hypertension, heart disease, and I will end there. And I will have 5 on 6 or 4 on 5, right? Rather than to include hypo that I would now have minus. So guys, these are the 5 questions I have for you as far as this area of Nclex is concerned. Go read more on this area and make sure that you don't miss any question in the Nclex. And I have one last question for you. Answer this question, drop your answer in the comment section and I will reply. I gave the answer to this question already when I was explaining. Drop your answer. At this point, thank you for watching. See you in my next video.